Hi, my name is Vanessa Barajas, and my topic is acne. I am going to talk about the integumentary system, the development of acne, different type of acne, grade levels and severity, and how to treat acne. So there are 6 primary functions of the skin: sensation, protection, heat regulation, secretion, and absorption. The integumentary system also has 3 layers. The epidermis, which is the most superficial layer, has 5 layers itself, which is the corneum, lucidium, glandulosum, spinosum, and lastly the germinativum. And right in between the epidermis and the dermis, there's this layer that is called the dermal epidermal junction, which connects the epidermis to the dermis. And the dermis is the middle layer, which has 2 layers, the reticular layer and the papillary layer. And within the dermis, it contains connective tissues, which are made of collagen, protein, and elastin fibers. And right on the bottom is the hypodermis, which is also known as the adipose tissue and contains 80% of your fat. The development of acne. So on the left picture, this is the normal hair follicle, and on the right, it's an infected hair follicle, which is infected with pus and inflammation. So the development of acne can be influenced by genetics, also hormones. So when your androgen fluctuation occurs, it contributes oil production, causing acne. It also, the premenstrual water retention can cause slight swelling, enough to influence the epidermis and blocks the pilosebaceous unit. The environment also can develop acne. Exposure to poor air quality, free radicals, can increase inflammation, which response of the sebaceous glands. And lastly, lifestyle. So stress can stimulate the adrenal gland to produce hormones, which leads to more oil production, as well as your diet. Food with higher glucose index, processed foods with heavy iodide content can contribute to acne. The different type of acne. So the first one is called a pustule, which is filled with fluid from dead white blood cells. The second one is a closed comedone, which is a whitehead that has an opening of the follicle that are blocked with debris and white cells. The third is called a cyst, and it's a nodule made up of deep pockets of infection. The fourth is a melia, or small epidermal cyst that appears as firm white papules. The fifth one is papule, which are red inflamed lesions, which can convert into a pustule. And lastly, we have the open comedone, which is a blackhead opened at the surface and exposed to oxygen. So there are 4 grade levels of acne. We have grade 1, As you can see in the picture, there's minor breakouts, mostly open comedones. Grade 2, many closed comedones, occasional papules or pustules. We have grade 3, which are red. It's red, it's inflamed, many comedones, pustules, papules. And then we have grade 4, which is the most severe, which is cystic acne, lots of papules, pustules, and inflammation. Grade 4, there could be there is caused scarring, tissue damaging. And how to treat acne. Having a healthy diet, exfoliating, making sure you remove all the dead skin cells, and medicated treatment, and visit your local dermatologist or esthetician. Thank you.